Good morning. Thank you all so much for joining us here on the G.U.M Network. Today, we're going to be featuring the present and future of healthcare for communities of color in the age of Trump. And we have two experts really here today to help us unravel this mess that we find ourselves in. First, we have Ms. Blegay, and we have Dr. Nicole Rochester. Thank you, ladies, so much for joining us. Guys, I want you all to look in the description below. Their bios are truly impressive, but these ladies come with a wealth of experience. And I want you guys to tell us a little bit about your background and share some info with us about, first of all, who you are and why is this issue important? How does it affect our people?
Okay, I can start. I'm Blegay. I am staff attorney for the DC Nurses Association. I'm also a community activist and a community lawyer. I have my show Chat with the Lawyer, where we give advice to everyday people about issues that impact our community. Healthcare means a lot to me. I would tell you my background story. And before I actually start, I want to let you all know I am running for, also candidate for a state delegate in District 25, which includes Central and Southern Prince George's County. So if you live in those areas, please reach out to me at walla@wallablegay.com. Yes, check me out. Go to my website, www.wallablegay.com. So I was one of those that went to the hospital when I was in college to get treatment because I had an allergic reaction. And I was, after the emergency room took care of me, they determined that I wasn't on I didn't have health insurance because I was on Medicaid, but when you turn 18, they take you off of Medicaid. And so I was sort of given a bill of $3,000, which at that time, I couldn't afford that. That wasn't a possibility for me or my family. So it led to a lot of devastation, credit issues, and then finally we were able to get it forgiven. But that actually woke me up into the healthcare issues, and that's what my story is, what a lot of people in our community experience. And one of the things that we need to focus on is changing. It needs to be a drastic, radical change in the healthcare system. I'm a big advocate of single payer programs. My family is in Europe, and they live a comfortable life. My cousin has 2 kids, one with extreme autism, another with sickle cell, and they are not living in debt. They would not be able to afford the lifestyle that they have in London, here in the United States. One of the bigger problems is that our healthcare system is based on the biggest insurance that people get through healthcare, the coverage is employer-based. But you have to have a job that can provide that. Now, the ACA has provided some protections of that, but not really. It's not complete because it does allow you, if you have an employer plan, the employer has to pay. If it doesn't, then you have to pay a penalty, all of that, or you have to buy it within an exchange. But the exchange, it depends on where you are. The cost can be really high. Some people rather pay for the penalty. Also, healthcare just becomes so expensive for lower income that they usually use Medicaid. Medicaid. But Medicaid, there's a lot of limitations with Medicaid. And for the older generation, they have Medicare. But then there's prescription issues, the hole in prescription that isn't covered. There are a lot of some of the things that they have to pay out of pocket is very expensive for older community. So it's like, it depends on where you are. First of all, your job determines your health care. What's covered in one job, and what if you don't have a job? Absolutely. Then that means that you either have to buy into a system, and that depends on, you have to go into the market, the healthcare market that's both through the ACA, but then it depends on where you are. So if you're in a rural area, sometimes you don't have very many options. Right. And then if you buy the cheaper plan through the healthcare exchange, usually those cover some things, but a lot of things are not covered. So if you get a chronic illness in the midst of that, then you can be paying a lot until the enrollment period, which is now shortened.
True.
So, so there's so much I can go on and on about what the changes, but the point is our system just isn't working. And the worst part is now we've been threatened on the federal level of what they're going to take away. states need to create a actual safety net. And that's why I'm trying to push a single payer in states. Unfortunately, at this time, we can't trust the federal government. We don't know what's going on in the White House and on Capitol Hill. Some of them, those people don't have really the mindset to really make changes to help people. They say it's so complicated. It's complicated because they're making it complicated. Single payer program puts all these little things here. You don't have to worry about what job you go to. Now, and single payer does not stop people from getting private insurance. If you want to get private insurance, the point is you have the biggest insurance market, which helps bring the cost down. They have a new website that they put out in Maryland called where I gotta find the name of it, but the website actually shows you what different procedures cost in the state of Maryland and different hospitals. So you actually see the cost. So you see a hip replacement at Johns Hopkins might be $25,000, but then you go to I think what was the one that was lower on the list? You go to another hospital, you get the same thing for $13,000.
Wow.
So it just goes, and we don't think of it in that way.
If we go to the mall, we know what prices are and what have you. Now, Dr. Nicole, you are a doctor.
Yes.
And I know that you experienced, so we have an attorney and a doctor both that find this system a little complicated. Tell us a little bit about, first of all, how did you become acquainted with healthcare navigation, even outside of your practice?
So I'm a pediatrician by training, and as you mentioned, I've had 20 years of clinical practice. But when I really became intimately familiar with healthcare was when I became a caregiver for my dad. So back in 2010, my dad became very ill, and my sisters and I had to really kind of take over with caring for him, really inside of healthcare and outside of healthcare. But as the physician in the family, I was the one designated to deal with his healthcare. And I was blown away with, as Wallace said, just how broken the system is. And, we were constantly having to navigate things, coordinate his care, get the doctors to talk to one another. And I experienced things that I knew that they existed as a physician, but it's very different when you're on the other side.
Wow.
And so I became very frustrated. I was scared, even as a physician. And many times it was only because of my experience that we were able to get things done for my dad. And I thought that was very unfair, that my inside knowledge was often the thing that was getting my dad what he needed. And so it made me think, well, what does everybody else do? Not everybody has a doctor or a nurse or a healthcare professional in the family, and you shouldn't have to have a certain level of savviness or, behind the scenes know-how to just get basic healthcare. So eventually, fast forward to now, and I decided to form a company called Your GPS Doc. And just like your GPS takes you through and lets you figure out where you're going in your car, the mission of my company is to help patients and caregivers navigate the healthcare system. So I have been very closely following, what's going on with the healthcare reform. I have a slightly different opinion than Walla in that I am actually a very strong advocate of the ACA. I don't think it's the fix for everything. And I've thought about single payer healthcare. I'm still kind of in the middle with that, but I will say that millions of previously uninsured Americans are now insured because of the Affordable Care Act. I think it's gotten a really bad rep with the current administration because it carries that nickname Obamacare, and so I do feel like in some ways people don't want to acknowledge the good that it's done because it's associated with our former president. But the reality is there's over 11 million people currently being covered under the Affordable Care Act, and the uninsured rate in the United States went from 16% to 8% just with the implementation of the Affordable Care Act. The other thing I do want to point out is that for people who are unemployed and don't have a lot of income, the good thing about the Affordable Care Act is that the law mandates that there are subsidies where the insurance companies have to lower the premiums for people that make us under a certain amount. So they'll qualify for tax credits for the premiums. And then there also are what's called cost-sharing subsidies, which is what President Trump got rid of a couple of weeks ago, or he got rid of the funding for those. And that actually limits how much people spend out of pocket. So your co-pays, your deductibles, your co-insurance is limited. And so, if you don't fall in that income bracket, then yes, you actually can pay quite a bit. And I will say that as a self-employed person now, and my husband is also self-employed, we actually do have insurance through the Affordable Care Act, and it is expensive. But, for people like me,
Absolutely.
I'm not going to qualify for those subsidies. But I have a nephew who pays, I think, $25 a month for health insurance.
Wow.
So
Wow.
I think that the Affordable Care Act has done a lot of good, and I'm very worried about these efforts to repeal it.
Sure. Now, what's interesting is that, clearly a lot of these issues are important for us all, but in particular, when it comes to communities of color, in lots of my reading and my research, I saw no matter whether it was an income aspect or a state aspect, is that communities of color do worse. And honestly, it was sobering to me, looking at issues like asthma or autism or any of issues that affect us more. And I say us as in people of color, that'd be African Americans, Hispanic community. Healthcare is even much more of a detrimental issue. And I was reading that lots of times when certain immigrant groups come over here, they're healthier when they come, and then they kind of buy into our American lifestyle and become sick.
True.
That's
True.
And
so you look at environmental justice or healthcare justice. Sometimes it's really scary. It's really sobering. So can you guys just share a little bit about some of the things that you've seen, whether it be bias or access to healthcare, or even physicians or practitioners or specialists offering people of color certain resources, and why they do or why they don't?
Well, I can start with covering something. There are so many. It's like it's not enough time in the day to kind of go over the problems. But here's the thing. One of the things in some of the community of color, the issues, especially for those of parts of our community of color that are low income, right, is lack of proper preventive care.
Definitely.
You know that as a physician. So what happens is that lack of preventive care at one point piles up, right? So at one point you go from being healthy to having a severe chronic illness. And that's where the loopholes in the system really show themselves, because the more care you need when you become chronically ill, the more money it costs. And if you're low income, you don't have that. So let's just say I represent nurses at United Medical Center, right? And they complain, United Medical Center is right in the middle of Southeast DC, which is a high population of African Americans, mostly low income still, even into change of the district. But yet, when those patients come in, they have so many chronic illnesses. But the payment of Medicaid only lasts for 3 days, 3 to 5 days, for them to actually be inpatient care. So the point is that if you actually need so much more care, if you were higher income, probably lived in Bethesda, could go to Georgetown, you could spend more time having all these people that can kind of provide you with care. But for those people, they don't have that option. They have to leave the hospital at certain times. So then they have these programs that are also kind of disjointed, that maybe they can, so the nurse will say, well, you have to go to this clinic to get this, and you have to go to this clinic for that, and this clinic for this. That person works out and doesn't go to those things.
Absolutely.
So there's a holes in the system, but also once you get into the chronic illness mode, like I said before, for some people, your employer-based coverage, it determines where you go. So if you are under, some people don't. Some people love Kaiser for preventive care, but they don't love Kaiser for chronic illnesses, right? So then you have to, if you are at one employer and they only have Kaiser Permanente, you have to go with Kaiser Permanente. So if you have cancer, all these things you have to go through, you have to pay, actually to leave the Kaiser network, you have to pay more money. Right, to go to specialized doctors. And now Blue Cross's Blue Shield, sometimes they're getting more expensive and going to certain types of doctors. That impacts our community, because community of color, some of us have a lot less wealth, right? A lot less. We're more in debt. Definitely. So we don't have the disposable income, some of us, to really pay this and that. It's one thing to pay a $25 copay, but it's another thing to have to pay the max of $5,000, which sometimes you have to have when you get to more chronic illnesses. Now, then you have the people who, so then you have our poor that's under the Medicaid, right? So those that are low income are under Medicaid. Well, the problem, Medicaid covers some things, but some things are not covered. Depends on what state you're in, what's covered. So then that impacts our health care. Then on the other hand, for Medicare, a lot of those a lot of older communities, I mean, Prince George's County, sometimes we assume that people in Prince George's County who live in big houses, who are African American, have money. But a lot of the older folks do not. They live on very fixed income. So if they get a chronic illness and they have to go to all types of treatment, that means that they have to start borrowing money from family members to do so. Now, that's not unique to just the community of colors, but it impacts us more than it does others. So it is the disjointed system that impacts us more, because if you have that. Now, preventive care, like I said, some places are really, it depends on your insurance, right? So Kaiser's kind of really good at pushing people for preventive care, but some of the healthcare and health insurance are not so much. Now, employers are trying to encourage it, but it depends on where you are, depends on where you work. And some in our community, especially a lot of immigrant communities, they would take jobs that don't necessarily have a full employer so then they'll have to go into the market. So if you got an immigrant that's come here and that they're driving a taxi cab, right, or doing Uber, right? The Uber considered an independent contractor. You're your own employer according to the law. So now you're going to have to get something through the market, which of course you could say it could be good, but those $25 plans don't cover. You pay $25, but then so you pay later for things if it gets if you're healthy, it's different, but if you're not healthy,
I agree. Wow. I agree, and I think from my perspective, I completely agree with everything she said, and there absolutely are disparities within the healthcare system, and as you alluded to, for pretty much every chronic condition, whether it's diabetes, hypertension, heart disease, asthma, there's true evidence that people of color get less quality care. They're referred to specialists less often for the same problem than someone who is in the majority. There's lots of implicit bias among providers of healthcare, even African American providers and other providers of color. These are things that we just are kind of in us, and when many of us aren't even aware of those things. And so we know that pain is not treated properly in communities of color. And then, as Walla mentioned, a lot of it has to do with where you live. So in many communities of color, they don't have access to a lot of the primary care providers. A lot of doctors have gotten out of the Medicaid business. The reimbursement is really poor, and so they've stopped taking Medicaid. And so, it can be really difficult for someone on Medicaid to actually find a provider that takes their insurance. And then you have all the other things, all the other social determinants of healthcare, so things like pollution and lead and clean. Look at what happened in Detroit. You have this clean drinking water, things that we just take for granted living in the United States. Asthma is a perfect example where if you live in an apartment building that has a lot of dust or mold or a cockroach infestation, you're going to be disproportionately affected. And so even if your asthma is being managed properly with all the medications, if you're in that environment where you're constantly being exposed to allergens and you can't afford to buy the fancy mattress cover. I remember as a pediatrician in primary care telling my patients or their families, go out and buy, the mattress cover to protect from like dust mites. Well, those things cost like $50, $60. Well, if you're on a fixed income, are you going to spend $60 on a mattress cover?
Absolutely.
That $60 is for your food or your gas to get back and forth to work. I have a question for you as
well, because some might say, well, I don't fit. I make $100,000 on my job. My husband makes $150,000. That doesn't affect me. But I was reading that there's also bias. I mean, for instance, even similar to like the housing mortgage, where certain buyers were not presented with certain loans or just immediately presented with higher interest rates just because they were black. So from the healthcare standpoint, can you shed some light on that as well? You mentioned kind of implicit bias because, again, whether you're living in a mega home and on a fixed income, people will assume that you have money, or whether it be a doctor that might, perhaps not even realize it, may not even realize it, or may realize, who knows, whether it's, straight up discrimination or implicit bias, not offer specialists to, certain communities of color.
Yeah, and that kind of comes back to what I do with Your GPS Doc, because as I was mentioning in the intro, I didn't walk in the room announcing that I'm a doctor, and I don't dress particularly fancy. I'm just a normal, everyday person. And so, I think that was great in some ways because I got a chance to see, I think, how some people of color are treated. And so if I would accompany my dad to an appointment, because I'm a physician, I would just sit back and just listen. I was there as his daughter. But I would notice that certain things weren't being discussed or certain options weren't being presented. And so, maybe just as the layperson, again, just being the daughter, I would ask a question, and then, I would, if I wasn't happy with the answer, then I would have to kind of throw my weight around a little bit and say, well, actually, I'm a physician and I'm familiar with, and then all of a sudden it's like the gates would open. Absolutely. And so, I can't say for sure, definitively whether those providers, I'm not going to say they were racist, but I can absolutely say that often there's just an assumption that goes along with communities of color. And I think most healthcare providers, if we're honest with ourselves, we have to acknowledge that there is implicit bias. And so whether you are looking at someone of color and deciding that maybe they can't afford a particular treatment, or, it's very complex. And a lot of it happens in your subconscious. But that's what angered me, is that it was because I had that inside knowledge, I was able to ask for very specific things that I knew would benefit my dad, things that somebody outside of healthcare wouldn't even know. I was reading a couple of days ago that people of color are not offered the same treatments for HIV. They're not offered the same treatments for cancer. I mean, these are life-saving therapies that we all learn, in our training are helpful. And so one could think, like, how could you not offer that, and it's not that people are bad, I mean, there are some people that are inherently bad, but most are not inherently bad, but there's all these assumptions that we have in our minds, and so we have to be educated. I mean, now more than ever, Americans have got to be educated, and we've got to learn how to advocate for ourselves. We've got to read, we've got to ask questions. We can't just sit in the doctor's office and assume that the information is that we're getting all the information that we need. Those days are long gone.
So in other words, that it does exist, because I think that it's sobering. First of all, as a person who lives in a multi-ethnic community such as the D.C. Maryland area, and I'm telling you, for me, it was a little bit of a culture shock. And it's just, I know that there's discrimination and all that, but you kind of feel insulated in a way. But when you look at just how structural bias is, and you realize it, and you think about it, I was just asking the doctor earlier as well, and while I'd like you to chime in, is that when you look at these changes that are happening right now with the ACA and with Trump Care or any of those, these pieces, that some people will die. Like, that was really sobering. For me to read this, and that these changes affect real lives, and like a lot of things will disproportionately affect people of color.
Yeah. And one of the things I'll say, they say, one of the highest reasons for bankruptcy is healthcare costs. And I, would chat with a lawyer. We offered, to connect people with lawyers. And that's actually the biggest call that we get. People who are in the midst of healthcare issues and can't afford their lifestyle. We mentioned people that are not even lifestyle, they're healthcare. We mentioned people that are making a lot of money. I think it's an assumption, that people who are making a certain amount can afford it. One of the things we talk about bias, we're not here to talk about financial bias, but the financial instruments that they bring into African American communities and community of colors sort of allows us to be in such debt that a lot of us don't have money saved up for these rainy day fund. And what ended up happening is that, cancer has been increasing in our community. And I don't have any statistics, but what that's really getting people, you get cancer, and all of a sudden you have to pay all of this out-of-pocket costs. And it is one of those things with these trials that different trials that you can get in order, experimental trials and different things, those things cost. And I mean, it can cost quite a bit of money, and a lot of people can't afford to get a caregiver to be able to watch through the process. So what you find is that a lot of people actually just really suffer. Like, people are dying today because families are like, we can no longer afford this. We can't move forward. We're going to have to just do end-of-life treatment, take them to the hospice, and say our prayers. But that's really what's going on right now. That's why I said it's time. I am running for state rep, and what I'm focused on is how can Maryland provide the protections that are needed, because we don't know what's going to happen on the, just sort of removing subsidies where people have to pay more out of pocket. Or, at this point, you've got a family that, I spoke with a family 2 weeks ago that's looking at $4,000 that they've got to pay out after they've already paid $20,000 out. So, even if you added $5 or $6 more, we talk about tax credits. People don't see tax credits immediately. That's one of the things about sort of these policies that sometimes it looks good on paper, right, to put tax credits. But the idea is that for people who are in need, they can't wait to file their taxes and then wait for the money to come in February or March. They're really they're really struggling right then and there to find money to subsidize. And for healthcare costs, when you go down, a lot of people, you can't. Personal loans get harder. You know what I mean? Those things. And then that drags our people more into the debt that they end up having to file for bankruptcy to get out of all of it. And now these financial companies are aware of that. So they're not being so open to give out personal loans because they don't want to end up losing money on the bankruptcy side when the person files for bankruptcy. So my point is that it is the system that we have here, regardless of, I don't like Trump. But the point is we have to get a system that makes sense. I mean, the ACA, one of the things that the ACA I was one of those that worked on the Hill during the time they were pushing the ACA. And I was working on the bill on the Education and Health Committee in the House of Representatives. And one of the things, I was working on the employer side, the ERISA side. But one of the things that was there was a public option, right? And a cost decreaser, right? You have to have, now they do have like very cheap plans that help people, but on the other hand, those a public option would have really been able to help drive costs down.
Wow.
I just want to piggyback on something Wallace said about caregiving, because that is a huge issue, and it really kind of illuminates the fact that your health care really is tied to your assets and your income.
Wow.
Because health care is much more than just being able to go to the doctor, being able to afford your prescriptions. I mean, that's a huge part of it, but it's the everyday. If you have an older family member who's, starting to have a little bit of dementia and they're not eating properly and they're forgetting to take their medication, well, if you work and your spouse works and, your siblings work, who's checking on grandma? And in certain communities, it's nothing to pay somebody, upwards of $1,000 a month, where you can have a caregiver that comes into the home and makes grandma breakfast and makes sure grandma takes her medication. If you can afford that type of caregiver, then, you're going to preserve grandma's health that much longer. But many people in our communities, they can't afford those kind of resources. And so you do the best you can. Maybe somebody calls in the morning and tries to remind grandma to take her medication, but there's a steady decline in health. And if you don't have access to money for those types of resources, or even assisted living facilities, which cost, $3,000-$4,000 a month.
Wow.
How many people have those types of assets? So it really does come down to a have and a have not.
And let me just kind of go into the details because of the legal part of it, I see some of these issues. In order for you to put your person in an assisted living community, it's so expensive that people usually say, let's just do Medicaid. But in order for you to do Medicaid, you have to have pretty much no money. So if somebody owns a house or anything like that, that impacts how their how much they have, their assets, which Medicaid considers. So what families do is they move the assets of one older person. So this person who was probably going to want to just give their kids something through their will are now going to have to let everything go and move the house and everything and the money and the 401k or pension into another family so they can wipe out their assets so that they can qualify for Medicaid.
You have to be careful with that because there's a look back period.
Exactly. There's they're on. So then there's people that got in trouble for that because of doing that. So that's one thing. Another thing is that for people, especially for community of color, if you can't afford to get a caregiver, a lot of people said, I'll just do it myself. That's the issue. That becomes another issue. Under the law, the Family Medical Leave Act only allows you in DC 4 months in Maryland 3 months to take care of your family members. So that's, I mean, what if your family member has a long-term illness?
Correct. Then
So
what?
what you would have to do is your job actually only can do 3 months. Now they have the thing where they have temporary FMLA where they allow them to do once a week and all that stuff. But the thing about it is that causes a lot of issues at jobs. So you know, those are things that we need to focus.
So I think
next steps.
yeah, in terms of next steps, I think that, you know, we just you need to be informed. You know, if you're not somebody who watches the news, and I personally kind of stopped watching the news for a while, but you really have to stay in tune because these things change every day. Literally this morning before I came in to do this, I said, let me just hurry up and check and make sure that there wasn't some new update with healthcare because you just never know. So we need to be informed. You know, we need to pay attention in these elections. We need to pay attention to where people stand on healthcare. As I mentioned before, we need to be advocates for ourselves and for our family members. We need to ask questions at the doctor's office. We need to make sure that we understand everything that's being presented to us, and just be active and be informed. That's really the best thing I can say is be informed, advocate, ask questions.
Wow. Walla?
2 words: single payer. It's, I mean, I sound like a broken record, but it is the answer, I feel, in this time of need. I suggest you call your representative today, call your congressman, call your local representatives, and ask them to put forth a bill or support a bill. And actually in Congress, they have a bill on single payer. It's time. We need to stop playing this game of these various insurance companies. At this point, it is only leading to more confusion that you actually need to hire an expert like you to get through the process. This shouldn't be. It doesn't make sense. We are the only first world country without a single payer program. If we are talking about the best country in the world, we're looking at others, judging others, and they all have single payer. You even have third world countries that have single payer program. Make it simple for us. Call your representative, say, I want a single payer healthcare program, and vote for Walla for delegate.
Of course. See that, guys? Where can people find out how to connect with you? What's your website?
Oh, yes, thank you. So my website is www.yourgpsdoc.com, and you can go there and get lots of free information, tons of information about navigating healthcare. I am also a speaker. I'm happy to come to churches, community organizations, retirement centers, large conferences, anyone that can use this information. And so find me on my website. I'm also on Facebook and on Twitter on Your GPS Doc.
Ms. Walla as well?
Yes, you can contact me, give me a call at 202-441-7650. You can also email me at Walla, W-A-L-A, at Walla Blegay, W-A-L-A, B as in boy, L-E, G as in girl, A-Y.com, or you can go to my website, www.wallablegay.com.
All right, guys.
Thank
Absolutely.
you.
I think these guys are amazing, right? Guys, thanks for sticking with us. This is really, truly an important issue, and I hope that this conversation, this dialogue has empowered you to not be afraid, but instead to go and seek the information, because knowledge is power, but the application of knowledge is really, really power. So guys, we thank you, and feel free to visit us on our website at www.thegumnetwork.com. So until next time, guys, be powerful, be amazing in all that you do and say.